NCLEX RN practice questions and answers for 2025 with RATIONALE. 1. A client asks why a diagnostic test has been ordered, and the nurse replies, "I'm unsure, but we'll find out for you." When the nurse later returns and provides an explanation, the nurse is acting under which principle? 1. Non-maleficence. 2. Veracity. 3. Beneficence. 4. Fidelity. Correct answer. 4. Fidelity. Rationale. Fidelity means being faithful to agreements and promises. This nurse is acting on the client's behalf to obtain needed information and report it back to the client. Non-maleficence is the duty to do no harm. Veracity refers to telling the truth, for example, not lying to a client about a serious prognosis. Beneficence means doing good, such as by implementing actions, e.g., keeping a salt shaker out of sight, that benefit a client, heart condition requiring sodium-restricted diet. Cognitive level. Understanding client need. Management of care, integrated process, nursing process, implementation, content area, fundamentals. Strategy. Use the process of elimination. The correct answer is the one that matches the description in the STEM. That is, the nurse made a promise to a client and kept it, which constitutes fidelity. 2. An individual has a seizure while walking down the street. During the seizure, a nurse from a physician's office is noticed driving past without stopping to assist. The individual sues the nurse for negligence but fails to win a judgment for which reason? 1. The nurse had no duty to the individual. 2. The nurse did what most nurses would do in the same circumstance. 3. The nurse did not cause the client's injuries. 4. The nurse was off duty at the time. Correct answer. 1. The nurse had no duty to the individual. Rationale. To be guilty of negligence, the nurse must have a relationship with the client that involves a duty to provide care. The relationship is usually a component of employment. The nurse did not necessarily do what others would do in this situation. Although the nurse did not cause the client's injuries, it does not prevent the nurse from assisting in this situation. Although the nurse was off duty, the nurse could have assisted if motivated to do so. Cognitive level. Understanding client need, management of care, integrated process, nursing process, implementation, content area, fundamentals. Strategy. Use the process of elimination and nursing knowledge. The correct answer is the one that recognizes that the nurse was not in the role of employee at the time of the incident, removing the requirement of acting on the client's behalf. 3. A client with cancer has decided to discontinue further treatment. Although the nurse would like the client to continue treatment, the nurse recognizes the client is competent and supports the client's decision using which ethical principle? 1. Justice. 2. Fidelity. 3. Autonomy. 4. Confidentiality. Answer. Autonomy. Rationale. Autonomy refers to the right to make one's own decisions, which is the principle supported in this situation. Justice refers to fairness. Fidelity refers to trust and loyalty. Confidentiality refers to the right to privacy of personal health information. Cognitive level. Understanding client need. Management of care. Integrated process. Nursing process. Implementation. Content area, fundamentals. Strategy. Use the process of elimination. The wording of the question indicates that only one option is correct and that you need to select the principle that is consistent with the circumstances in the question. 4. A staff nurse concerned about maintaining client confidentiality would take which action while carrying out assigned duties? 1. Read the records of clients not assigned to the nurse to become familiar with disease processes. 2. Share information about a client with nurses from the unit to which the client may eventually be transferred. 3. Allow the client's family to review the medical record to obtain answers to their questions. 4. Share information about the client with those involved in planning nursing care. Answer. 4. Share information about the client with those involved in planning nursing care. Rationale. Client confidentiality is maintained when the nurse shares client information only with those currently involved in the plan of care. Staff should only access information about clients currently assigned to their care and should not access information about other clients on the unit not assigned to them. Client information should not be shared with nurses who are not currently working with the client. Family members would need approval from the client and the healthcare provider prior to reviewing a medical record. Cognitive level. Applying client need. Management of care. Integrated process. Communication and documentation. Content area, fundamentals. Strategy, select the response that protects the client's information but allows communication necessary for the delivery of quality care. 5. A client is referred to a surgeon by the general practitioner. After meeting the surgeon, the client decides to find a different surgeon to continue treatment. The nurse supports the client's action, utilizing which ethical principle? 1. Beneficence. 2. Veracity. 3. Autonomy. 4. Privacy. Answer. Autonomy. Rationale. Autonomy is the right of individuals to take action for themselves. Beneficence is an ethical principle to do good and applies when the nurse has a city to help others by doing what is best for them. Veracity refers to truthfulness. Privacy is the non-disclosure of information by the healthcare team. Cognitive level, appliant need, management of care. Integrated process, nursing process, implementation. Content area, fundamentals. Strategy. The core issue of the question is the ability to interpret which ethical principle is operating in a specific situation. Eliminate beneficence and veracity next because they focus on the obligation of the nurse rather than on a right of the client.